Welcome to the journey. It's me with Eddie again, and we are joined by a guest today who is a board certified sports medicine specialist. He is a specialist in a variety of musculoskeletal, neurological, dermatological, systematic, and endocrine conditions and injuries, including rehabilitation of injuries, ACL reconstruction, hip labrum surgeries, foot and ankles injuries, overhead thrown injuries, cervicogenic and migraine headaches, focal dystonias, e.g., Runner's dystonia, osteoporosis, osteopenia, stress fracture and stress reaction, thoracic, I believe that is, outlet syndrome, conversion disorder, complex regional pain syndrome, or CRPS, RSD, and gastroesophageal, sorry if I'm saying that wrong, reflux disease, which is GERD. Our guest uses the most up-to-date medical research and exercise science to evaluate, treat, and design training programs and exercise prescriptions. He also utilizes the most recent technology and equipment for video analysis and injury screenings to help accelerate injury recovery. He designs precise prevention training programs for his patients and teams, and he offers a variety of treatments, including functional dry needling, spinal manipulation, instrument-assisted soft tissue mobilization, mental imagery and visualization, and active release technique. Quite a bio, but I
Wow.
welcome Dr. John Jowers to the journey.
Thank you so much, David.
You're welcome. Now, me and Eddie have always spoken about journeys begin, and obviously journeys begin at a young age, and something obviously spurred your journey. So tell us what spurred your earliest memories.
Well, my earliest memories that lead me to where I am today have to do with family. I actually had no idea as I was growing up that it was even within my family to get into medicine. And as I grew up, I got more interested in the human body, weightlifting, exercise, and sports. My father was into weightlifting, and from a very young age, he taught me about musculoskeletal anatomy because his uncle was in Mr. Olympia contests, and he's who got him interested in athletic conditioning. And to this day, I have a anatomy poster on my wall, and I use this for patient education. And this very poster was the one that I used to stare at when I was a kid and into high school as I would lift weights with him, we would be staring at this picture of muscular anatomy. And I would just sit there in between sets staring at it and analyzing muscles, not realizing that years later I would end up becoming a physiotherapist who would specialize in that very thing, musculoskeletal anatomy. And to this day, I cherish that poster and cherish those times that family experiences have brought me to. The journey even goes before that. My father's grandfather, my great grandfather, he used to be a physiotherapist, and he was from Norway, immigrated to America, and a land of opportunity type of story, and worked his way up the career ladder, starting off as a massage therapist and self-studied and self-trained and shadowed physicians to learn more about the craft. And I didn't even know, I knew him as a kid. He passed when I was about 10 years old, so I got to know him. But I had no idea until I was older that my grandmother told me, yeah, he used to be a rehabilitation specialist. So now it runs in the family.
Nice, very nice.
So the question is, obviously you've got family of your own. Would you want your family to carry on with the tradition?
Oh, that's a great question. My family loves, I have three kids, and they love coming up here to our clinic, which is a lot like more of a gym than it is a physiotherapy clinic. And they love what I do and the concept of it. They're not too interested in blood and wounds and things like that at this point. we're leaving it open-ended. I'm not sure what they want to get into. Ultimately, even if they don't want to carry on the same profession that I'm in, my wife and I support them in whatever it might seem that uh, God grants them with the gifts for. We're not sure. We're passing it along, and it's our hope that the interest in athletics and human movement and healing is something that they eventually begin to appreciate.
Yeah, and it's just, everyone has a unique perspective, and when you learnt your way, even though you learnt it from your family. So it's always like you always had an element of your own style to the layer. So you've had like two generations before you, pretty much, and
Yeah,
you,
How old are
and
the kids?
that's part of the journey. My kids are 11, 9, and 5 right now.
Oh, so they still have a long way to go before they make a decision.
Exactly. Yeah, we've got plenty of time to mold them in ways and see what their loves and interests are. I do have evidence of them saying at one point that they're interested in becoming physical therapists, but we'll see.
Nice.
and the excitement of obviously as you grow older and the fascination got more passionate. Did you find it more difficult understanding, or was it just an ease of understanding it because of your family knowing so much already?
That's a great question. I did find that it was easier to understand to study human anatomy and physiology because of my family loving it and raising me in that kind of atmosphere. Uh, but especially more so because it was interesting to learn about. I didn't find it to be daunting the way we think of studying in high school or college to typically be. It's not at all uh, it's not at all daunting because when it's something that you enjoy and love, it's fun studying human anatomy and physiology and exercise science. So I really enjoy it. In fact, my leisure reading is very nerdy. I read exercise science research and anatomy research and things like journal articles while sitting on the beach. You know, it's nerd reading, sciencey reading, and I love it.
Yeah,
You know that
no,
that
go on,
I'm
Eddie.
sorry, Dave. It's funny you say that because I have I have a 16-year-old daughter who goes to the Silva Medical Magnet School here in El Paso, which is kind of like a pathway gateway fast track to get people into the health the health world, medical world. And my son, who's 20, he graduated from the same school, and he's an RN. He wants to become an anesthesiologist, and he loves reading about anatomy, the body. He's into the different books on anesthesiology. And my daughter's just like, that is so boring, bro. Like you're such a nerd, And it's like, but she's following his footsteps, and she knows that medical field is the way to go. But she hates blood. She hates human body. She's like, I don't want anything to do with this. But I think I'm going to end up becoming an X-ray technician. So she's kind of the same way. I tell her, as much as you like to argue, you should become an attorney. You know, but
Nice, yeah.
but yeah, the medical field is a very interesting, and it has to be a very special person that takes on and
Yeah.
gets involved in that field.
In the same way that it takes a very special person to get into law.
True, true. But I the medical field is a blessing because you'll always have a job.
Yeah,
It's recession proof. It's everything proof.
yeah.
And especially with athletes and stuff like that, there is no lack of work.
That's for sure. There's definitely a an outlook over the next 10 years that physical therapists are are going to be in so much demand. We're already in demand, and now it's going to get even higher because of the desire to want to cut down on medical healthcare costs. Generally, physical therapy is inexpensive compared to surgery, injection, medications, things like that. So insurance providers want to push physical therapy, which is why there's so much more demand for it. in the near future.
Yeah. And it goes. I know I haven't been in England, the UK for 7 years, but I know when I was in the UK, healthcare as a whole is free unless you're a private patient. But they do encourage physical therapy as a whole more so after you've had surgery because they don't want to pile you on with tablets. Because many doctors like to say, okay, it's medication, it's injection, quick fix, go away. I don't want to see you. Physical therapy is not a case of I'm massaging your back, I'm fixing you. It takes time.
Yeah. And over the past few years, it's changed to more of an exercise approached recovery as opposed to a hands-on massage or modalities approach. It ebbs and flows. There's going to be another trend in the future of modalities, but it in general is currently in this trend of recovery looks like exercise, whereas in the 80s and 90s it looked like like bed rest and getting massages and using hot packs all the time. Not that those things are bad, but it was just so heavily focused on. And now it's more like get active because we see the science is there that no matter what you're recovering from, to make a generalization of it, your recovery needs to involve physical activity.
Yeah, very true. And, the demand of, when I was ill, for example, they gave me medication, which was fine, but they also encouraged me to be mobile when I was able to be mobile.
Yeah. And when in the past, like 40 or so 50 years ago, the opposite was true. They said, "Oh, you're injured. You need to get back to bed. You need to rest and recover." And we know now that, okay, yeah, of course, relative rest is important when our bodies need to recover, but not bed rest for multiple days on end. That just weakens the body and might feel good in the short term, but sets you up for poor long-term recovery.
So I'm dealing with a rotator cuff issue right now, and you were talking about trends, and so I'm thinking I just recently jumped on the trend of fasting. I'm on my 20th hour of a 100-hour fast. And it's amazing
Wow.
how wonderful I feel. I thought I was going to be hurting and stuff like that. And the fact that I'm going to therapy, 3 times a week. And you're right, it involves, yeah, I have a messed up rotator cuff, but yet we're sitting there working out the rotator cuff. And it's just like, wait a minute, hold on a second. When I was back in high school, playing football, it was always like, oh, you're hurt. Take some time out, rest, relax, don't do anything. And here it's the opposite. And it feels great, to be quite honest with you. And it's not just the traditional heat pad, it that helps as well. But
Yeah.
I just out of curiosity, since we're talking about trends, what's your thoughts on fasting? I mean, any opinion on it?
Yeah, I've formed an opinion on it. We as physiotherapists can advise people on nutrition and consultation, and I think, in fact, that we'll see a change over the next few years that PTs will be better specialized in nutritional healthcare. I think that's the next big trend. I think fasting is has too much potential for it to become trendy because people use it as people use it in a very gimmicky way in self-help books and really quick 10 to 30-second blurbs of videos on their social media. Ultimately, the more important, when you boil down decades of nutritional research, what's more important than fasting is one's basic knowledge of macronutrients and proper nutrition, meaning when they are eating, that they are aware of what they're eating, macronutrients being fats, carbs, and proteins, and being aware of the ratio of those that they're getting in and the amount that they're getting in. Because ultimately, fasting, someone could use intermittent fasting, for example, uh, and still gain weight. If their goal is to lose weight, it's still possible to gain weight with intermittent fasting, because they use it as an excuse, for example, to just cram in too many calories in the 6 hours that they are allowed to eat.
Right.
You know, So that's why it's generally more. I still use it as a tool. It's a great tool to have, but only after someone has demonstrated good fundamental knowledge of important um, the importance of nutrition and macronutrients.
Agreed.
So going into the modern way of how things are now into the now, do you feel like things have changed so dramatically over the last decade or even before? Does how things have progressed into such a way that it's easier to follow nowadays and understand because, you hear about sport players, for example, having major injuries. Now, ACL, you usually out for at least a year unless you can recover miraculously really strong. But do you feel like injuries are not as bad as they were compared to when, if I was growing up in the 80s, someone had an ACL, they'd be out, like I said, for a year. Someone has an ACL now, they're out for 6 months. It doesn't seem no time at all. So do you think advances has changed that?
We, in all of healthcare, we see approximately the same rate of injury. Some injuries that are occurring more, some are occurring less, but overall, people are still getting injured. But you know what the difference is? The recovery. Think of the past 200 years or so, how human lifespan has increased, right? In the same way, quality of life has somewhat increased in most developing countries. And I do think you're right, David, that it is because of people's knowledge of those injuries or the recovery of those injuries. They're better able to educate themselves on what to do about it, and they have generally better access to healthcare to recover. But at the same time, there is a lot of misinformation out there, and that can lead to some people being swayed one way or the other, being led astray into a rabbit hole of something that they shouldn't be bothering with, and it ends up delaying treatment or taking too long because of something that they're trying that's not successful, or that um, or technically could be, yeah, snake oil. It's something that really isn't a tried and true method. Those kinds of anecdotes exist all out there on the internet. And so that's the give and take of having better access to healthcare and healthcare information.
Yeah, and the example I would like to always refer to nowadays when I've seen it, soccer players, especially goalkeeper, they got gloves on their hands, but I've heard in recent years goalkeepers have been playing major tournaments, but they've had a broken hand or they got a broken finger. And I'm thinking, are they coping so well? Because surely there's a pain threshold still when still being a goalkeeper. Because how can you, I know people's thresholds are different, so it's understandable, but how can you perform at your top performance while still having a broken finger, for example?
Right. And that's because of the advances in healthcare. That broken finger is now better able to be treated, and we know how quickly we can get that person back out onto the pitch without them re-injuring it, or stabilizing it in a way that they can play with less risk of re-injury. The same goes for even larger injuries. There was a famous injury in the NFL, Joe Theismann, when he had his leg broken by Lawrence, and in a horrible tackle that just ended his career. But now that same injury, uh, a tibial fracture, is able to be stabilized, not just to the point where it's not career ending, but where someone can get back into the NFL a year later. Like, not just to be able to recover, to be able to play in that elite level. And that was over the course of the past 30 years that we've seen that difference in healthcare advances. It's amazing.
Yeah. And it's very, like I was saying, the goalkeeper back in the day, this is why I refer to the goalkeeper. Goalkeepers had nothing to protect their hands. Then gloves came out. Gloves protected to a certain point, even though gloves were very basic. Nowadays, the gloves are so padded, I believe that is the key to why they are so defined in injury because their gloves are pretty much like their bones because it protects
Yeah.
them.
Yeah, that's a good example of the advances in protection in healthcare, and the same with helmets. Medical, the technological advances in helmet, even in shoes, even in the quality and texture of the soccer ball.
Yeah.
There advances there too.
And you see protection for front first responders nowadays. Gone is the basic helmet, which was basically a cloth hat. Now you've got a full Kevlar helmet and it's protecting you really solid.
Yeah, and and that's a big passion of mine, protection and prevention. There's such a focus in our healthcare system towards reactive care as opposed to preventative or proactive care. And that example, like helmets in firefighters or sports or anywhere like that, that's one example of many of preventative care. We're less likely to see traumatic injuries in healthcare because of those kinds of preventative measures, but we still need to really push forward with preventative care in a way that changes what our healthcare system in developing countries looks like drastically.
Totally. So obviously, and this is a question I know Eddie would ask as well. People will be wanting to know more about you as a whole. Is there any written work you've done that you can make available for people? Is there a website? Is there a book?
Yeah, people can find me on various social media pages. My personal and professional social media page is on all social media platforms. My handle is at Jowers DPT. That's Jowers DPT, which stands for Doctor of Physical Therapy. And you can see examples on some of those platforms like Instagram, uh, TikTok, and X of various videos of what I do in my line of work. I've been written up in a handful of articles. If you web search Washington Post, I was our clinic launch is here in the Washington D.C. suburbs, and I was written up fairly recently in a Washington Post article about a patient um, that had a focal dystonia. As you read about in my bio, one of my specialties is dystonia, which is a neurological condition and a very interesting one. I had a patient who went to multiple, and you'll read if you search the article, Washington Post, John Jowers, you'll see that this woman went to so many different healthcare providers over 7 years to try to figure out what was going on with her leg. As she was running, she kept on clipping her own leg. It was always turning inward. It was almost like she would practically sprain her ankle every time she'd go running, not literally, but almost all the time because of how often this was happening, and she could not control it. She went as far as getting a knee replacement, figuring, I need this knee replacement anyway. I might as well get it done and see if this fixes it. It didn't fix it. And she said in a final flurry, I'm just going to try a different PT. She tried me out, and I told her, you don't have an orthopedic condition. This is a neurological condition called a runner's dystonia. And sure enough, I sent her to a neurologist, and it was diagnosed. It was confirmed. Through that experience, she went back. She was in her 50s at the time, and through that experience, she left her line of work that she was in at the time in sales and went back to school to become a physical therapy assistant, and now works at Walter Reed Army Hospital as a PTA because she had such a positive. And I had no idea that she even went back to school to do this. And that experience with me was her inspiration for doing that. So look up that article if for those of you who are listening, and you can read a little bit about that story. It was really cool.
Yeah.
Nice.
Any more further questions from you, Eddie?
No, I mean it's just interesting. Like I said, the whole medical field really intrigues me, and physical therapy, as I get older, seems to be more important. I go to the gym and things seem to hurt a lot more.
And we must emphasize older in inverted commas. But it does creep up as you like Eddie says, it does creep up in such a way when you are a certain age. I'm 42, Eddie's 21 for the sake of it.
I wish. 50, just turned 53 and I feel like I was feeling like I was 100.
But but it does creep up and it does hit you in certain ways that you think it doesn't hurt when I was younger, but it hurts nowadays. So I just know it's creeping in for me slowly, but I still got a bit of creak in me.
I
So,
encourage any one of your listeners to reach out to a local physio, talk to your physical therapist. We are the experts in exercise science, and we can help in great ways with uh, combating that very word that A word, aging.
mm,
Mm.
that's why I done
Um,
my hair so it doesn't show. So the journey comes to an end, but obviously on that journey, people are often inspired by something that is really pushing them to be inspired to be, yes, I can. I feel successful. I feel rejuvenated. What would you say to those people watching or even listening to help them in their journey?
I think years ago I would have said um, that inspiration came from um, a love of the job or it's rewarding or something along those lines. And it is very rewarding. Um, but ultimately, the older I get and the more I'm in this line of work, the more that I see uh, that it comes from us as human beings loving each other and how important that is to build community uh, because we have each other for such a short period of time, and I cherish every moment now. And despite all the pain that I help people with, treating pain is what what we do all day as physical therapists, um, and even through those times, uh, in fact, because of those times, it's what builds perseverance. And so, I find that I find myself cherishing the moments in life that are free of suffering, free of pain, even more than I used to. Um, and so I think that listeners who are looking for inspiration can find it in community, meaning get out and help others. Volunteerism, whatever it might look like, it might look like meeting one on one with someone. Um, every everyone's in different stages of life, but I encourage everyone to find inspiration in community.
I love that, and I always believe in community wherever you are in the world because, growing up in a small community, even though where I was a big, vast area, it was still small because everyone knew everyone. And
Hmm.
I just believe community is the key to everything, and
Yeah.
successful communities work well together and unite together without disgruntled feelings everywhere.
Hmm.
John, thank you for being part of the journey. Eddie, thank
Yes,
you
sir.
for your questions again. I know your insights are helpful as always because it helps break up the balance where if I'm struggling, that's where Eddie comes in. So thank you again for both of you for being part of the journey today.
Thank you so much, David. Thank you very much, Eddie.
Always a pleasure, Doc. It was great meeting you, and good luck and congratulations on a successful career. And um, I think people do take physical therapy a little bit for granted because, like, I didn't want to go to physical therapy because I thought it was going to hurt. But it's been a good journey. the last couple of months.
Nice.
Thank you, Tom.
Every journey begins with a single step, and this one, it's the story of Cat Girl and Wise Tiger, two hearts, both fierce and free, stepping into a world of new beginnings. With every sunrise comes a chance to start again. There'll be ups and downs, moments of love, bursts of laughter, and shadows that test the soul. They'll face their past, their fears, and maybe find the courage to heal what was once broken. But through it all, they'll never lose that young at heart spirit. Because when you believe in yourself, when you believe in each other, anything is possible. So what are you waiting for? Adventure, emotion, and heart await. It's time to pounce into their story and begin your own journey too.
Oh, good afternoon, everyone. I've just been listening to the Paramedic Chris children's books on audio again, and I just love it because they've given a tribute in one of them to my dad as well, who passed away a few years ago. I love audio books, and it's great to walk around, and it's great to sit at the computer, if you're out jogging or wherever, to listen to them as well. All 4 of the Paramedic Chris children's books are available on audio book from Amazon. Go and take a listen to them. You won't be disappointed. You'll hear what happens when a community pulls together and supports one another. The best thing is to pop over to my website, paramedicchriskidsbooks.org, and you'll see the links on the shop page. Keep safe, everyone, and thank you for being you.
Hi there, I'm Michael Drake, and I've written a book called The Paradox of a Mortal Mind. It's an invitation to slow down and really think about your life as a temporary part of who you are as a person. I want you to step back and think about, the things, the chances that you have in life, and the relationships that you have in life, and what you value. And the book is like I said, an invitation to slow down, really think about where you are and where you want to go, and just embrace the beauty of impermanence. Embrace the fact that you will be a picture on the wall one of these days, and it's your opportunity to leave an impact on the people that you love and the community that you have. And it's really about how you make people feel at the end of the day. And so you can pick up my book anywhere on Amazon, anywhere in the world. It'll ship right to your door. It's called The Paradox of a Mortal Mind. It's by Michael Drake. And I also have a website. It's called themortalmind.com. And you can get my audiobook, my ebook, and I hope you enjoy it. And thank you very much for being here.
The Journey podcast explores stories of personal growth, challenges, and life-changing moments. Each episode dives into unique experiences, offering insights and inspiration for listeners navigating their own paths. I believe everyone has a story worth sharing. If you'd like to share your journey with David and others, email your story to wisewords1983@reborn.com, and it may be featured in a future episode.